Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to this edition of Community Health Matters. I'm your host, Kellie Davis. On this edition of Community Health Matters, we will be exploring behavioral health services and treatment offered by Vista Community Clinic. Our first guest on today's show is Cara Walstein, Behavioral Health Manager at Vista Community Clinic. Hi, Cara, and thank you for joining us.
Thank you for inviting me.
So what is your role at VCC? What you do there?
I manage a very busy behavioral health department, and we work with the people who are referred to us by their primary care providers, and we do a lot of screening and assessment, and we do ongoing therapy. We have psychotherapy, we have licensed clinical social workers, and then we have physicians, of course. We have an alcohol and drug counselor, and a care coordinator. We have a lot of people involved in helping patients get their behavioral health needs met.
And I understand that Vista Community Clinic has a new program. I guess, is it in the Behavioral Health Service Department? What is that?
It is in our department. It's a brand new program. We're really excited about it. It just rolled out in January. So what we're doing is we're helping people with opioid use disorder who are coming in. They're either on painkillers, they're on maybe illegal drugs like heroin, or they're having a lot of chronic pain issues and they want to get off the dependency of these opioids. And so there's this new wonder drug called Suboxone, which is, there's some big words here, but it's buprenorphine and naloxone that creates Suboxone, which we use as a medication-assisted treatment to help people get off of those drugs so that they can start living more normal lives.
If they take this wonderful drug you're offering, is it a cure or is it manages?
It's a maintenance program. We start with an induction. They come into the office. They get referred to us by their primary care provider, which we call PCP, and it's not the drug, it's the physician. And they come in and we do an assessment and we screen them to see what their needs are, and then we get them the help that they need. We've got these really big cozy chairs they get to sit in when they have an induction, and we want to see how the medication's going to take in their body because it's different for everybody. You know, if they're already on a methadone program, we want them to be down to about 30 milligrams for at least a week before they start with us. They are going to be in a little bit of precipitated withdrawal when they come to us because we don't want to have them on anything else when we're giving them the induction with the Suboxone. So if they're taking anything like benzodiazepines, they would not be appropriate for us because what they have to do is get off everything, including alcohol.
Is this an inpatient or outpatient treatment?
We are an outpatient doctor's office. So from the outside, you'd never know that we're doing treatment in there because it's where you go for your doctor.
Your clients, they have to come into your facility and then go home and hopefully kind of adhere to the program?
They do. They have. There's a lot of rules, of course. I mean, they have to come back often and come to an educational support group, or they can be with other people who are going through this as well. They can have individual therapy with our alcohol and drug counselor, or a licensed clinical social worker, and even meet with our psychiatrist. So we've kind of got this wonderful full scope of help for them.
It sounds awesome. And
it is.
And how does, if there's someone watching, for example, that might have an opioid use problem or condition, how can they get started with your...
They get started by coming to see one of our primary care providers, the PCP, what we mentioned before, and having that general physical exam. Then that physician would refer to the MAT program, which is the medication-assisted treatment. There we will start doing an assessment and see, you know, are they ready to give up this stuff, you know, because we're finding out that there's actually a decreased mortality rate of 50% for people getting off those street drugs, or maybe they're taking too much of their prescription drug and they're finding that they're having cravings and they have withdrawal if they're not on it, so they get this dependency going, and we can help interrupt that. We can help them get back into life, get to work, go to school, have better relationships, and it's really amazing.
When they come to the program, and I know you just started, do you know how can you judge about how successful it has been so far?
It's been very successful. All over the country. We're not new to this, we just are in this area.
Oh, okay.
But I've been to a lot of trainings and conferences, and it's just awesome what's happening with people. They are getting off drugs. We're lowering the rates of HIV and hepatitis C, with needle exchange. This is kind of what we would call a harm reduction technique, although, abstinence is ideal, but you can't help a dead drug addict, right? We have to help them where they're at and what they're ready for. And so this is where a lot of people are ready to look into it and say, well, what can we do here?
So you mentioned PCP, primary care provider, but you also have a primary care setting. What is that, and how does it relate to behavioral health concerns?
Well, it's a great way to be seen. A lot of times people are afraid to go to a mental health clinic because then they think, oh, I'm crazy or something. And here you're going to just see your regular doc. And basically we can look and we can screen, and we have a better way of identifying that, oh, someone has depression or someone has a lot of anxiety or trauma that needs to be dealt with. And so we have greater access. It's more convenient for the patient to go to their regular doctor's office. There's not that stigma attached to it. Even the methadone clinics, they're appropriate for a lot of people. We like to see them come in where they don't have to do that morning dosage every time. They can just come into the doctor's office, and they can even have inductions at home. And then they'll come in for group, have their pills counted. They may need a drug test to make sure that they're adhering to the program.
Are there any other programs that VCC offers for someone who wants to get off of narcotics?
We do. We have an alcohol and drug counselor that will meet with them. They can do phone consultations. You can see them in person. He'll be doing groups every week with a lot of wonderful curriculum to help people with mindfulness training, teach them how to live without these debilitating drugs that are controlling their lives.
And what do patients need to do in order to get enrolled in your medicated assisted?
Medication-assisted treatment, we call it MAT. Now you know why, MAT, M-A-T, MAT program.
So how can someone they're like, how do I get involved with that?
How do they learn about it? They can tell their doctor if they're a VCC, Vista Community Clinic patient already. They just say, hey, I'd like to meet with someone in the MAT program. And then they'll be referred to one of our, we call it data waivered physicians, who have been trained in inductions and are able to prescribe the Suboxone. They're very well trained in it. We have several physicians that are already up and running with this. They've been doing a lot of inductions already.
Okay. So if they go to their primary care physician, if it's outside of VCC, do they have to be a VC?
They do, because we want to have that continuum of care and that full scope picture of that patient so that we can provide everything that they're going to need.
So they do have to come to you.
They do. They have to come to us. Sorry, we're not doing home visits yet.
But is that something in the future, the home visits?
Definitely it could be, because we just started our telepsychiatry program as well, where the patient can come into the office and see a psychiatrist that's available to them in Orange County.
Isn't that something? So they come to and so it's kind of a, I don't know, Skype, telecom?
It is. It's just like you're looking at your TV screen having an interactive consultation.
Well, thank you so much for coming on our show today. It was wonderful.
You're doing great. We're gonna try this again, okay?
Okay.
Wheels, pedals, handlebar, brakes. Sit up straight, keep your weight in the center, keep your eyes on the road, hands on the grips, butt in the seat. If we feel ourselves falling, what do?
Just keep pedaling.
Good girl. Now remember, it's all about balance and steering. Steer with your hands, steer with your body. Steer into the corners and you stay out of trouble. And the bell's your buddy, so go ahead and ding that. All right, ready? Here we go. Pedal, honey, pedal. There you go, you're a bike rider.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Welcome back to this edition of Community Health Matters, exploring behavioral health services and treatment at Vista Community Clinic. Joining us now is Dr. Murray Bennett. Welcome to the show, Dr. Bennett.
Thanks for having me.
So your role at VCC is?
A psychiatrist.
And yeah.
So I interview patients, and we formulate a sense of what's going on with that person in terms of their problems and their worries. get a treatment plan set up, and sometimes that includes medications. Often it involves psychotherapy, and we get that all lined up for them. Sometimes there's some investigations need to be done, like a blood test or something, but we get all that set up from the first visit, and then follow them from there as part of a team.
Mm-hmm. And how does in a behavioral health setting, in terms of speaking about that, how does a psychiatrist differ from a psychologist?
Well, I know that the psych is at the beginning of both of the names, so it's kind of confusing. We both study psychological illness and all the theories about treatment. Psychologists have training that specializes only in psychological factors, and psychiatry goes after medical school. So all psychiatrists have completed medical school and then afterwards done training in psychiatry in the same way that a medical student on graduation would consider being an obstetrician or a neurologist, a family doctor, pathologist. They can choose to go into psychiatry. And so we're within the more the medical side of that spectrum.
Your colleague, Cara Walstein, mentioned a new program at VCC called, let me get this right, Medication
Assisted treatment, yes.
So are you the person that is assessing that and I don't know if it's diagnosing, is that correct? Help me.
Medication assisted treatment is a form of clinical care directed towards addictions. And in some addictions, a medication can assist with that. In other cases, we're moving more towards complete abstinence. I am part of that on the side, but the more lead doctors are some of the internal medicine docs who are working with patients with pain syndromes and substance use concerns, and then helping them make that transition to a safer regimen.
So it sounds like, especially with this behavioral health services, it's beginning to sound like it's a collection of things, and that's why you have a team to sort of address it. So is a patient going to more than one doctor? Is that a fair assessment?
True. It's the idea of having a home within the 5 clinics or more. There actually is more than 5 clinics now.
At Vista Community Clinic.
Vista Community Clinics. We have various sites. And so you would see providers at any one of those sites, but we're all linked within one system of care. Generally, it starts with your primary medical provider, a family doctor, or a woman's center may be how a patient gets first involved with a pregnancy and then connects with the clinic with their child, going to the pediatric clinic and following up with family medicine. Psychiatry and the therapists are a part of that. We link as part of a team. The idea is that the patient doesn't have to go away from their home, their clinic. It's the same place they get all their medical care and their dental care and their chiropractic care.
One home setting, yes, kind of, so to speak. So why does behavioral health services play such a critical role in the overall health and well-being?
Well, our overall health includes both physical and mental, and one pushes up against the other. It's pretty clear evidence for us in the science community that mental illness, when treated properly, helps patients cope with their medical illness better. So a diabetic patient does much better in terms of managing their diabetes if someone also pays attention to the problems with panic attacks or depression. Patient with a heart trouble, similarly, if they have having problems with blood pressure and they've had a heart attack and they have anxiety, having someone properly take care of that anxiety at the same time means they're going to do better with managing their heart condition as well.
So obviously you take the physical in account when you're doing your sessions as a psychiatrist, yes, and exploring their treatment and
that can include medications, but it also looks at lifestyle, which they hear about from their family medicine doc. They also hear about it from us on the behavioral health side about diet and exercise, participating in community, volunteering, being active, reconnecting with family, maintaining some sort of regular rituals. And getting the more of life.
Mm-hmm. So, of course, in my brain, when I hear a psychiatrist, mm-hmm, I think about the chair, the Chase Lounge, and I see Dr. Bennett there. Is that? That's
kind of an old Woody Allen script thing from psychoanalysis in Manhattan, where I think there still are a lot of psychoanalysts and people who have very deep pockets to pay to see a therapist on a daily basis. We try to destigmatize that as best we can and have simple offices where there's just a chair and I talk, and I'm probably going to be typing into the computer while we talk so I can keep notes, and try to make it simple as easy as possible. So there's no couch, there's no laying down, let's just sit and talk.
But it's still that, again, someone listening and someone talking, and is it an assessment? And
initial visit is an assessment, and then over time, it's a follow-up visit in terms of how well did this treatment that we started last month, how has it worked? Are there any side effects? Did this work or not? And make some adjustments from there. And also make sure you acknowledge the improvements. This is great. You're making great progress.
So, what kind of conditions are you personally seeing coming into your?
Primarily in a primary care clinic like we have here with Vista Community Clinics, we see problems with depression, anxiety. Some patients have problems with panic attacks and panic disorder. People may have had some traumatic event in their life, or something more recently, like a car accident, can cause some element of PTSD, post-traumatic stress. So in that kind of setting, we work directly with the therapist, where psychotherapy plays a primary role. And sometimes our patients have problems with addictions. They've had troubles with alcohol or other substances, and so we'll help steer them in the right direction, and at the same time treat any mood symptoms that may be going along and helping them in their recovery.
Is there a particular demographic that you are seeing?
Pretty wide open, because there's one of my colleagues is a child psychiatrist, and so he sees under 16, and the other psychiatrists I work with, we see all the older adolescents and on up. So the whole range, from pediatrics to geriatrics, from little kids to elderly folks.
So when they come to get assessed or evaluated and you're doing that initial, do you have a different, set of questions or a different way of doing it depending on the age, or is it just
it does vary with age, yeah. There's going to be less of a history in someone who's younger, and somebody who's older has got a longer life story to tell. And somebody who's coping with more medical conditions, we may focus on that and what they're struggling with in terms of illness. Somebody's younger, it might be, what hassles are they having at home and raising their kids, and that might be the major stressor for a mom or a dad.
If someone is having a condition, where could they go to get checked out, or they think they might be having
the first start is to check in with their family medicine provider, primary care provider at Vista Community Clinics, or through their obstetrician at the Women's Center. It could be their son's pediatrician, and then ask about referral to seeing somebody in behavioral health. That's the first step.
Well, thank you so much, Dr. Bennett. And when we return, we will have for our final guest, Alita Zappone, a licensed clinical social worker at Vista Community Clinic. We'll be right back.
Spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
Welcome back. Our final guest on Community Health Matters is Alita Zappone, clinical social worker at Vista Community Clinic. Welcome, Alita.
Thank you for having me.
Yeah, I'm so happy you're here.
Thank you.
What is your role as a licensed clinical social worker at VCC? What is that?
Well, my role as a licensed clinical social worker, and people use the term LCSW for short, is to provide behavioral health services to the patient to make sure that all their behavioral health needs are met. So what does that mean? I would do a psychosocial assessment on the patient to see what the problem areas are and to establish a treatment plan for them. I also provide psychotherapy, which is psychological therapy, and there's different types of those that exist, which I can talk about a little bit later. I do health education because some patients are sometimes confused about what their diagnosis is, either their physical diagnosis or their mental health diagnosis. So I help educate them on what that might entail and what kind of things they can do to better their physical and mental health. And I also do resource coordination. So I would refer patients to sometimes just basic needs, survival needs, food, clothing, shelter, maybe domestic violence shelters, or anything that they need, whatever they need to take care of their mental health.
Walk me through this, because is it fair to say that you do, is it an assessment that you do?
Yes. So as human beings, we are very complicated and we are made up of different aspects of ourselves. So I do a biological, psychological, social assessment. So I do, we talk about with the patient, what are some of maybe some genetic things that they've inherited from their families, either health-wise, physically, or mental health issues. We can inherit certain tendencies to have certain medical or mental health issues from our family. So that's a biological aspect, what's going on with their biology. And then I would talk about what's going on with their psychology. So what kind of thinking patterns do they have that affect the way they feel about their life or situations that they're in? And then what does their social network look like? So are they connected? Are they isolated? Do they have positive relationships with their family members, or are they more conflictual? So I look at the whole patient and all of the aspects of their life that make up them. And each person's an individual. Our experiences through life, childhood, adulthood, maybe traumas that we've experienced, all these things influence how we feel about our life. So I think it's important, that's the approach I take as a licensed clinical therapist, to address all of the aspects of the patient.
When a patient comes to VCC, and Dr. Bennett and I were talking, because he also does assessment, it feels like Vista Community Clinic is a real team-oriented and how to get to the. So if they come in, do they come and see you first? Do they see someone like a Dr. Bennett? How does that
work? Well, usually they come in for a primary care checkup, so to their doctor, and they may be coming for some type of physical, medical issue. Maybe just a checkup, or maybe they're suffering from some type of chronic illness that would be something that's kind of permanent and needs to be monitored by the physician and regulated with medication, maybe a lifelong thing. So the patient comes, and then the primary care provider does an assessment of maybe some depression, anxiety. Maybe they come out high on that assessment. They're having certain symptoms that maybe the doctor feels like they would benefit from mental health services. They would benefit from therapy or psychiatry, or the combination of both. So if the symptoms are very severe, the patient may need both psychiatric intervention and therapy with the licensed clinical social worker.
So it's the primary care physician, like I think we said earlier on the show, who then says to the patient, see this psychiatrist?
They identify,
I
yes.
See. Okay.
So they would say, this patient might be a good candidate for behavioral health services. And that's how we get our patients. Now, psychiatrists, they refer to me as well. If the patient's just getting psychiatric services, then they would sometimes refer to me if they need therapy, because usually both is most effective for treating depression. Or if I'm seeing a patient and they need some extra help, or they may need medication, I do refer to the psychiatrist as well. So we work as a team.
That's awesome.
Yeah.
It really is. And you mentioned depression as one of the conditions that you personally have treated. What are there any others that you're seeing, like more than what are like the top ones that you're seeing?
Yes, well, issues that patients have, everyone is trying to get through life and succeed in life, right? And we deal with stressors. So sometimes those stressors get so hard and so difficult to cope with that we need someone to help us, and that's where I come in. So I work from a strength-based approach. So I try to focus on the patient's strengths, which is kind of rare nowadays, that you would focus on the strengths and their things that are going really well in their life and the coping skills that they already have, and I build upon those. So some of the issues that patients struggle with are depression, and it's very common. In fact, 7 to 8% of adults in the United States are suffering from depression, so it's very common. Another issue that a lot of people do struggle with is anxiety, and about 18% of adults in the United States are struggling with anxiety. So depression and anxiety, I have found in my practice at VCC to be two of the top kind of issues that people struggle with. What do those look like? Well, depression, people often have maybe symptoms that are lasting 2 weeks or more, and there's various symptoms, but major depressive disorder would be kind of having trouble sleeping, maybe insomnia, maybe hypersomnia, which is sleeping too much, having trouble getting motivated to do things that kind of used to bring joy in their life, and they don't want to do the things anymore, feeling bad about themselves, maybe some suicidal ideation. So these are some symptoms that a patient might be suffering with who have depression.
Okay, and there's another term that at VCC, a primary medical home, yes. I hear. What is that?
Yes, the primary medical home is just what it sounds like. It's a home where all your primary medical needs are being met. So you have everything in the same place. You have physical therapy, you have women's health, you have dentistry, psychiatry, primary care. All of these things are in the same place. So it makes the patient feel very at home and comfortable. And what primary medical home's purpose is patient-centered comprehensive health care. So that's the most important thing. You're meeting all of the needs of the patient because we are made of, so many different complex issues and needs. And if you only treat one need, if it's not a primary medical home, you're only treating maybe one or two needs, but there's more to the story. You've got to do the whole puzzle. You got to put all the pieces together to get a beautiful picture, and that's what I see VCC being. Each department is a different puzzle piece, and then you fit them together, and that meets the patient's needs, and they're happier and healthier, and they can live the optimal life they can live. That's our goal.
What advice would you give to someone that might be struggling with something like depression?
Yes.
And come to you.
Well,
and we got about 45 seconds.
Sure, you're not alone. You are not alone if you're suffering from depression or anxiety. Many people do. There are treatments for people who are suffering from these things. 1 out of 5 adults in the United States is struggling with a mental health issue. You are not alone. There's simple things that you can do. You need to pay attention to how your relaxation breathing helps. Sleep hygiene, taking care of how you're sleeping, not cutting down on caffeine before you go to bed, cutting down on watching things that are very upsetting on TV before you go to bed. So these are some things that you can do. Exercise is one of the most important things for increasing serotonin levels, which make us feel good. They're a neurotransmitter in the brain that makes us feel good, and optimizing brain health. So there's simple things you can do, but if not, and it's not helping, come see us at VCC, and we're happy to help you to make your life better.
Alita, thank you.
You're welcome.
Appreciate that. And thank you for joining us on this edition of Community Health Matters Behavioral Health Services at Vista Community Clinic. For more information on the services offered at Vista Community Clinic, please visit vistacommunityclinic.org. Thank you for joining us.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.